If you can, please mute your lines if possible. Thank you. All right, we'll go ahead and get started. Thank you all for being here for our Wednesday COVID-19 media briefing with Kevin Dick, District Health Officer. One update I wanted to give you guys was related to the COVID-19 vaccine that the Health District received yesterday. It's the Janssen COVID-19 vaccine. There's a lot of confusion over Johnson & Johnson and Janssen, and we're trying to kind of clarify that just because Janssen is the pharmaceutical company that is owned by Johnson & Johnson, and the box says Janssen on it. The card that you get after you get a vaccine says Janssen on it. So we're hoping to reduce the amount of confusion with that. So if you're able to call it Janssen and then put in parentheses Johnson & Johnson, that would be helpful. But any help with that would be greatly appreciated. That's all I got for today. So I will pass it on to Kevin Dick, the District Health Officer. Kevin, if you're ready, please go ahead.
Yeah, thank you, Scott. Thanks for providing that clarification, and thanks everybody for joining us today. As you saw, yesterday we did receive the Janssen COVID-19 vaccine, and we're excited to have another vaccine available in our efforts to get our community vaccinated. And we have already distributed some of the Janssen vaccine to REMSA to be able to use along with our public health nurse for the homebound vaccinations that we're providing. And also we've distributed some of that vaccine to the Community Health Alliance, and they're actually going to begin dispensing that in a pod that they have this afternoon. And the benefits of having a one-dose vaccine are really remarkable. And we're going to continue to dispense it ourselves as well as transferring it to other community providers in an equitable fashion. It's really important to understand with this one-dose vaccine, after 14 days, it was found to have 93% efficacy on preventing people from becoming severely ill and hospitalized. And then as that time period goes on, after people receive that first dose, after 28 days, it was found to have 100% efficacy on preventing hospitalization and death. So very valuable to have this new vaccine available for us to dispense in Washoe County. We have dispensed over 50,000 doses of vaccine here through the Washoe County Health District alone, 50,509 as of yesterday. And today the state updated their numbers for Washoe County. We're at 122,730 vaccines that have been administered to date in Washoe County. And we have over 9.5% of our population that's now fully vaccinated. We're still not receiving enough vaccine to really get to full capacity across our community. And so we're pleased to hear the White House reporting that they expect to have enough vaccine manufactured for everybody in America by the end of May, and we're eagerly awaiting to see that supply showing up here in Washoe County for us to further accelerate our efforts. We can vaccinate over 2,000 people per day at the pod that we're operating at the Livestock Events Center, but we have only had one day that we've had enough vaccine to have that throughput so far. And we have many other providers, smaller medical practices, et cetera, that could be administering the vaccine if we were able to have additional supply to be able to have out in the community. We're continuing to vaccinate our 65 and older population, as well as our community partners, the Renown Community Health Alliance, our fire partners, and our pharmacies. And as far as the essential workforce that the health district is focusing on, we are working on agricultural and food processing workforce, as well as grocery store staff and others in the end-to-end essential goods supply chain. So we have a big group that we're moving through right now, but we're glad to be able to get these essential workers to be scheduled for their well-deserved vaccinations. As far as our COVID-19 situation update, we have a 7-day moving average of new cases at about 35 per day. It's 34.9. The 7-day we've noticed can move around fairly significantly now that we're getting into some of the lower numbers of new cases per day. So we had a pretty good fluctuation of about 46 on Monday down to 35 yesterday, because we had a 100+ day drop off just over a week out. But we are, we think, remaining flat and hopefully overall trending downward. So we'll continue to watch those numbers. And we do have a positivity rate, test positivity rate of 5.5% right now. So we'd like to see that number get down. We're getting quite close to the 5% threshold that the World Health Organization has established as far as a goal to get below, to have things reopen. And so it's nice to see that we're getting down to some of those levels. But we are seeing headlines in the news about other areas of the country that are dropping mask requirements and allowing things to reopen. And I think that is premature. And I'm glad that we're not seeing that happening here in Nevada and in Washoe County. We need to continue to work to have our community vaccinated more fully, and to work to prevent the spread of the transmission of the disease, particularly with the concerns that we have of the various variants that have been identified and have the potential to be coming and be transmitted here in Washoe County. And we need to continue to be real careful because, just as a reminder, we can see things change really quickly with our situation with the number of COVID-19 cases that we have in Washoe County. And just from our experience here, we saw that in early October, we were running at around 80 new cases per day on average. And by late November, that had soared to over 500 new cases per day. So we can see really dramatic results and this virus wreaking havoc in a short period of time. And so it's really important that we continue to be vigilant and be successful as we move forward in order to be able to reopen our economy and have our society return to more normalcy. And the way that we do that is by all working together to get vaccinated when we have the opportunity, and to continue to follow these precautions as we work toward the herd immunity that we need for our community. So with that, I'll turn it over for questions, Scott.
All right, thank you, Kevin. Go ahead and fire away with any questions.
Hi, hey, Kevin, it's Dawn from the RGJ. Hey, I've talked to some people in the Down syndrome community who are worried that, you know, people with Down syndrome have such a higher rate of mortality. Is that something that worries you? Have you seen issues affecting people who may live in group homes or anything like that with Down syndrome being more likely to face tougher medical outcomes? And where do they fall on the vaccine calendar?
They are identified, Siobhan, in the state's playbook under the general population lane and individuals with disabilities. And so, we will be getting to them in that sequence. There are, a lot of arguments that can be made by a number of different groups of the risks that they face and where they should be in the playbook. But we're going to continue to follow the state's playbook, and they've considered a lot of these risks in developing that. They may modify this as we move along, but we'll continue to work with the state to try to follow a reasonable approach in how we provide the vaccinations.
Any issues that concern you about people with disabilities being, sicker? I know you break it down a lot by race and what and ages. What about people with Down syndrome or, other disabilities?
Well, we do know that we have had more spread that's occurred. So if they are in like a congregate living setting, those could be, those facilities are covered by long-term care facilities as far as getting those vaccinations. If they're not in those facilities, then there is a reduced risk of transmission if they're not in the congregate settings like that. And so I think that, we've got some of these factors that we've looked at in the state's approach.
Thanks.
Hi, this is Bob Conrad. What happens May 1? What are we looking at as far as capacities of venues, outdoor activities, and things of that sort?
Well, Bob, that's a good question, and it's something that we're still trying to determine. One is what does the local control mean when the state provides that after May 1st, and so we are expecting to get some more information from the task force meeting tomorrow from their perspective of what that looks like. And then we also have a working group that's working on, coming up with the criteria, the protocols that will be utilized as we have that local control to the extent that we have the latitude to make changes of how we might make those changes and what they would look like. And we are working to try to develop that information so that it's not a waiting game until May 1st, and then we reveal that information. But we hope to have that some agreement regionally and to be able to provide that information sometime in April, so people can kind of see what the plan is moving forward.
Okay, and to clarify, it's a working group that's coming up with the new protocols, or is it the health district or Washoe County proper? Who's doing this?
We're working to try to have a consistent approach across the region. So the health district is working with a representative from Washoe County and from each of the cities of Reno and Sparks as a core group as we're beginning this effort.
Okay, so who's got the legal authority then? Is it county proper, the health district?
Well, I think what we want to do is to each take our own our actions together on this, so it's a unified front. It's not really going to serve the community well if we have Sparks making one determination about what is going to happen in Sparks, Reno a different one, and Washoe County a third. So I think we want to try to align those authorities around the same approach.
Okay, thanks.
Hi, Kevin. This is Ben Marja with News 4. Friday marks a year since the first case. Could you just spend a couple minutes reflecting on the past year, maybe, the biggest lessons you've learned, maybe surprises, challenges over the last year?
Well, that's a big question, Ben. It's been a really difficult year, as we all know. I think maybe the biggest lesson is to be humble, and to recognize that there's a lot that we don't know. about this virus, and so we've learned and we've adapted as we've gone forward. I think another lesson is that to be successful, we all need to be working together to overcome the challenge that this virus poses for our community. And I've been, I think, really glad and it's rewarding to see how the health district staff, our regional partners, the National Guard, now FEMA, the volunteers have all joined together to continue to attack all the challenges that are put in front of us and to succeed as we move forward.
Hey, it's Valentina with KTVN. The Truckee Meadows COVID risk meter is yellow for the first time after being red and orange for so long. What do you think is the significance of that for everybody and for our community?
Thanks, Valentina. I think the significance is that our hard work and sacrifices are paying off. We are getting down to a lower level of disease transmission, and that's what we need in order to be able to have our businesses open and our economy move forward. But the yellow still signifies that we have to remain vigilant and careful. It doesn't mean that we stop wearing masks, that we go completely reopen, et cetera. But I think the risk meter has been a well thought out approach that they have developed over some time, and I think it's great to see that we are down in the yellow, and I think that reflects what we've seen with the trend in cases and positivity as well. So I think that the meter is aligning fairly well with what we're seeing out there in the community.
Kevin, it's Ben again. How optimistic are you that, we're coming out of the winter, tons of people are getting vaccinated. How optimistic are you that we are through the last big surge and really, really on the decline to the end of the pandemic?
Well, Ben, I just mentioned that one of the things that I learned was the importance of being humble with this, and there's a lot that we don't know about the virus yet, and so I wish I could say, oh, I'm just completely optimistic that we're not going to have another surge like we did before, and we're through the worst of this, and we're going to come out of this real soon. I think we have a lot of promise ahead of us with the vaccine, with the ability that we've demonstrated to be able to take the mitigation measures that are necessary to drive down the transmission of the disease. So those are both very, very positive things that we have to build on and move forward with. I think that's tempered by the variants and the impact that they and other mutations of COVID-19 could have as we move forward. And so that's why I'm particularly concerned to see states like Texas and Mississippi that are dropping the mitigation requirements and opening things wide open, because we know we live in an interconnected world, and we're connected with South Africa, and we're connected with Brazil and the UK, but Texas and Mississippi are part of our country and could have a much bigger impact on us as well as other states if we see those actions that could result in more opportunity for variants to occur that could set us back down the road. So I guess I'm cautiously optimistic, but concerned about what could happen with the variants.
Hi there, Kevin. It's Terrell Wilkins from the RGJ. I was wondering, I know we don't have a big supply of the Janssen vaccine yet, but I was curious if you knew how that vaccine would possibly affect the timeline of getting through you guys' current vaccination lanes.
I don't think I can really answer that for you, Terrell. I can tell you, while we got 3,600 doses this week, we're told that we're not going to get any next week. And so there was a stockpile that had been developed from the manufacturing that was released when the EAU was approved, but or the EUA, I'm sorry, but the manufacturing is not all ramped up for that vaccine. So I was really pleased to see that the federal administration was able to get that deal brokered with Merck to support with the manufacturing. And obviously the benefit of the Janssen being one dose is that basically one dose of the Janssen coming our way is like two doses of either of the other vaccines. So that will allow us to move through quicker with the Janssen product, but it's a matter of when we're going to see that production ramping up and actually affecting the supply that we're getting.
Got it. Thank you.
Kevin, one more from Ben just on the last year. If you could, I just want to know on a personal level, you've been doing these briefings every week, sometimes multiple times a week for, almost an entire year now. And just how has this year taken a toll on you and your job?
It's been quite a heavy lift, Ben, over the past year, and I have not had the work-life balance that I would like. So the work part of it, as you might imagine, has really taken over. And fortunately, I have a very patient and tolerant wife who is supporting me through this, while she doesn't get a lot of support from me as we move through this. So, no time off, no vacations, those types of things. So it's just been a matter of keeping on. So I feel like I'm starting to get to know some of you guys pretty well, and maybe once this is all over, we can have a little celebration together instead of a briefing.
What keeps you going, with working insane hours and no breaks, no vacations? What keeps you going?
Well, I think it's the mission, Ben, and understanding that our response to this is something where we need to move our community from one place to another. And so we're in the middle of that journey, and we're going to keep on through that journey until we get to the other side of this.
Thank you.
Any other questions for Kevin? All right. Thank you very much, Kevin, for that. As Ben mentioned, yeah, we've done a lot of these. This is actually the 77th recorded briefing that we've done since February. And Kevin has probably been on close to 95% of those. We started doing the ones with Jim English on Mondays and Thursdays. So if you have any other stats regarding or requests or questions regarding the Friday being the first anniversary of the first case, please feel free to reach out to me. And as always, this is being recorded and it'll be on the COVID-19 Washoe website under press conferences. Thank you very much.
Thank you.